Doctor with today's Live in 5. Today is Tuesday, April 6th. It is a few minutes after 5. Sorry about that. So we're talking about perimenopause and all kinds of things related to it. But did you know that thyroid dysfunction is very common in perimenopausal women, and there has been a considerable increase over the past couple of decades? Okay, these thyroid problems include autoimmune thyroid disease as the most common, but also thyroid cancer and hyperthyroidism. Now, thyroid cancer has increased threefold. That means 3 times as many in the past 20 years. And some experts recommend routine ultrasound as a screening mechanism during these years, since even an experienced medical practitioner usually only detects about 20% of thyroid nodules on physical exam. An ultrasound is benign, it's easy, it's non-invasive, there's no radiation, so it just requires a skilled person, and that's great. Okay, the good news about most thyroid disease is research is showing it is more treatable than once thought, and a diagnosis is not necessarily a lifelong need for treatment or medication. Okay, basically we can reverse thyroid disease very often. On average, 70 to 80% of the time we can reverse it with basic dietary interventions. Okay, so to reduce the immune inflammatory component that comes about. Okay, so this is really, really important. Now, there are 3 factors that drive thyroid disease in general. 2 you can't control: age and gender. Okay, even if you change your gender, it's what you're born with, not what you change to. Sorry. And your age, obviously, we can't control. So that is why it's a big thing for women around perimenopause, because it's very common in that age group, in the 40s and 50s. The thyroid, the third thing overall is your iodine status. Okay, this is a little bit interesting for me because there's one doctor that I was listening to, Dr. Alan Christensen, kind of opened up my mind to a possibility different than what I thought. Now, the thyroid can't function without iodine. It is one of the components that makes up the thyroid hormone. Many people can tolerate iodine over a broad range of intake. So you can be a little bit low, you can be a little bit high, you can be perfect, and you won't be affected by too much or too little. But people who are prone to thyroid disease, their window of tolerance is very narrow. Okay, and I can say that for fact because my daughter, who has a thyroid issue, which is resolved now, definitely got worse with a supplement that she was taking, which had half a daily allowance of iodine. Nothing excessive, but probably too much for her on a daily basis. Once a week, twice a week, it's probably not an issue, but on a daily basis or 5-6 times a week was just too much iodine for her because she is prone to having a problem with her thyroid. Now, in 2014, there were only a couple of countries that had thyroid disease related to iodine deficiency, and that is what I had always believed, is that thyroid iodine deficiency was the cause of many problems. But there are actually 52 countries that are at risk for thyroid disease from iodine excess, and the US is actually one of them. So I'm gonna keep it really short because I want to have you come back on Thursday to listen to more of this. It is very fascinating that what I thought may not be the case, right? So we have to be open. Our minds have to be open to learn new things and to look at things through with different glasses or through a different perspective, so that we don't get caught up in old beliefs, because things change, medicine changes, knowledge changes. So always be prepared to learn something new, and I have learned something new. So on that note, I hope you're having a wonderful day, and I will see you for the rest of this on Thursday for another Live in 5.